Doctors of Reddit. What is your most awkward experience when dealing with members of the opposite sex? NSFW. Edit. Please try and refrain from acronyms, because us uneducated folk have no idea what you're referring to. We are taught to explain to patients exactly what we are doing. As we are doing it, delicate wording becomes important during female pelvic exams. Instead of "okay, I'm going to place the speculum inside now, so you'll just feel some warm pressure," my buddy ended up saying, "Okay, I'm coming inside you now." The female patient responds, "No thanks. I already have 3 children." Edit. Not in Arkansas. Sorry folks. Also, my username is in reference to this. And no, I did not participate in this research. I just think it's pretty baller to have robot sperm. Did this by chance happen in Arkansas? Because my sister has 3 children and told me an almost unnervingly similar story. And we laughed our asses off about it for a good month. Edit. Holy balls, this is my highest rated comment. Good god. She's going to kill me. Last edit. I swear. Son of a bitch, I'd have died if it was the same dude. Ask my sis about it. The stories are identical. This tells me there's another woman out there with the same personality as my sister. Good lord. /u/spermrobot PLS. My granduncle is a urologist, and I got a boner from checking out one of his nurses when I was around 12. I then had to explain why I couldn't drop my trousers for an examination. He asked if I wanted to go to the bathroom to do something about that, so we can continue the examination. I had no idea what masturbation was, and he explained rather vaguely to me the gist of the operation. I didn't feel like trying it, so we just sort of waited until it went away. I don't know if it was awkward for him, but whenever I think about it, I cringe myself into the fetal position until I can block it again. So I'm a little bit late, but I have something. I'm not a doctor, but a pharmacy technician. About a year ago, a young woman comes in very upset and turns in a prescription for a bunch of anti-anxiety and anti-psychosis medications. All is going well until I realize we are out of one of them, and I have to tell her I have to order it for the next day. She was okay with it at first, but then I see tears building. I ask if she is okay and says yes. So I continue typing up the prescriptions. I want to say there was about 8 or 9. Next thing I know, she begins crying. She starts telling me that she was just released from a psych ward and she had tried to kill herself a couple weeks back. She rolled up her sleeves and her arms were covered in deep cuts. She began to ask me if I thought she would ever get reaccepted to nursing school, because apparently they kick you out after getting admitted to a hospital for psychological symptoms. I had no idea what to tell her, except that I hoped she got in and that, if she worked hard, they should give her a chance. I know this all may sound shallow, but I was not prepared for this. Nothing in pharmacy tech training told me how to react. So this was definitely my most awkward moment with the opposite sex. Reading through this thread and having a chuckle at most of them, this made me stop. I have been in similar situations, though none so drastic as that young woman, for which I'm thankful. I'm sick. I'm exhausted. I'm depressed and trying my 5th medication. And there's something wrong, whether the prescription can't be filled or my insurance isn't covering it. Sometimes the pharmacy tech was just fine. Patient, professional, told me kindly to come back if I needed to make some calls first. Sometimes the tech was rude/impatient. But there was this one tech who was awesome. She was explaining possible side effects of this antidepressant standard, and I was just about in tears because I was so tired of hearing it, and she just looks at me and says, "Oh honey, this isn't the first one you've tried, is it? I really hope this works for you. You just keep trying. It'll be alright." And she smiled. Just that tiny bit of humanity made my week. Even if the young woman in your story didn't go back to school, it probably meant the world to her that a stranger of a pharmacy tech took the time to listen to her and said something kind. I apologize for leaving you a small essay here, but please don't consider your story shallow in any way. You listened to someone who was worried and hurting. You went above and beyond your job description. You might have saved a life. I've got tears in my eyes right now because someone did that for me. Internet hugs sent your way. Kind stranger. X. Edit. Wow. What a gorgeous response. This made me so happy coming back and seeing that Cobo 10201's comment got noticed and my reply did too. Small acts of kindness can change lives. Internet hugs to all of you. I've always felt terrible that I couldn't do more for her. I felt like I didn't do enough. Your comment made me feel a lot better. So thank you. Internet hugs right back to you. My classmate and I were at a free clinic performing our first ever pelvic exams on standardized patients. Classmate is a big woman pillager of a man and gets to go first. He proceeds to insert his fingers to palpate for the bimanual exam. Our poor standardized patient shrieks right away. She promptly states that for all women's sake, he's gonna need to use one finger for those procedures from now on. What is a woman pillager? Is he like a Viking who mixed up his orders or something? Pillage the women. Rape the land. Not a doctor but a nurse. Trying to insert a catheter on a guy with a micropenis/inverted penis. One of my friends was getting a physical for a high school sport I believe. And when it came time for them to check his gonads, the doctor says cough, but apparently my friend thought he said hop. So here my friend is standing there. The doctor has my friend's boys in hand and my friend hops. Said it was the most embarrassing moment of his life. I had to put a Farley into a male part. I'm young and female. He seemed nervous as I started. Right when I was about to insert the catheter with his penis in my left hand and the catheter in my right, he abruptly asked if it would help if he was aroused for the procedure and proceeded to gain some girth before I could answer. I said no. He started to get aroused and thought, how can I save this? Oh I know. I'll make it seem like I'm trying to help. Doctor here. Recently walked in on a new mother in a sitz bath with 2 breasts pumps gulping away at her all the while her husband grins from ear to ear as I worked her up for a pubic bone injury. The newborn could sense my embarrassment. If it makes you feel any better, when I had my son, I couldn't have cared less if Matt's Thanksgiving Day parade trooped through my room. All sense of modesty went right out the door and I cared for people who saw what part of me during my time in the hospital. If you were there to help me, have at it. And thanks for all you do, Doc. We appreciate it. When my daughter was born, first grandkid, we were all taking pictures of her as the doctor was putting her on the scale and cleaning her up. It was not until we had the photos up on the 48 high definition in front of my entire family and most of hers that I noticed in one photo my wife is in the background completely exposed to the world with the doctor pulling the placenta out. I skipped over that one fairly quickly and edited her out. But not after cries from multiple people that they want to see the baby. When you get a vasectomy you get your dick taped to your stomach. A nurse came in to do the finishing after the procedure. She was middle age, and I'm guessing she probably got into nursing late because she was looking really nervous and uncomfortable. And anyone who's been in nursing more than a few years has had hands-on penis experience. She's kind of tentative and unsure about pulling the tape off. So I say, go ahead. It's been through a lot in its time. She got a big smile and ripped that speep off of there. So she's totally cool in my book. They didn't tape mine when I had my vasectomy. I guess a different procedure or... Oh. Posted about 2 years ago on a similar thread. 3rd year of medical school on my family medicine rotation which I'm doing on my med school's campus academic health center. Electronic medical record shows 24-year-old with chief complaint of cough. So I go in to interview her. Where it comes to light she's really there for vagina itching. Finish up the interview and tell her I'm going to grab my attending for the pelvic exam. My attending tells me she'll let me do the pelvic if the patient consents. I had already done ob/gyn at this point and was quite comfortable with it, but we both agree I'd likely get asked to leave the room altogether. Lo and behold, patient consents. I do the pelvic. We write her a script for some antifungals and she goes home. 2 days later, I'm teaching a small group of first year students how to perform an abdominal physical exam. Teaching is a requirement of the family medicine rotation when, during introductions, I come face to face with my patient who never mentioned she was a first year student. We both play it off really cool at first, but during the session, her partner asks me to show him how to do an inguinal/femoral hernia examination on a female patient, aka his partner. While I'm doing my exam, she breaks out in hysterical laughter, which causes me to lose it and start laughing at the absurdity of the situation as well. She played it off like she was ticklish, and I said something stupid like I thought of something funny. Don't mind me. 2 weeks later, she returns to the clinic for a follow-up, and I go see her. We talk for a while about how she's feeling, how awkward our second meeting was, and then just shoot the speep for a bit when she goes, "So when are you going to take me out to dinner?" I politely declined and explained I had a girlfriend at the time and never saw her again. TL. Doctor, I did a pelvic exam on a girl who ended up being a fellow medical student, though 2 years behind me, and asked me on a date at her follow-up appointment. Nice bedside manner. You'll go far. Maybe not deep, but definitely far. My perspective may be off the scope of the thread, since I'm a veterinarian, not an MD. In my experience, people who do not want to neuter their male dogs are always males. Having a frank discussion about the benefits of neutering with someone who is emotionally attached to their dog's testicles is pretty awkward. Excellent username, sir. Thanks. Relevant. I'm female. To me that makes it more awkward. I know I don't have balls, but